Hi, everybody. My name is Evett Ellis, and thank you so much for joining me today and having this awesome conversation and educational space to talk about increased telehealth access for victims and survivors of sexual assault and intimate partner violence, and how since COVID. So let's just dive right in. So, in the beginning, we all heard about what was happening with COVID. People were getting sick and they were displaying different things that, most people will go into a doctor's office and receive treatment for some of these different things. These are some of the initial symptoms. Things ended up, so as of June 3rd, 2023, we're over a million deaths in the United States of America alone, coming from statistics from the CDC. So, figure one, this is a figure provided by the CDC. It talks about the percentage of adults age 18 and older who use telemed in the past 12 months by sex and age in the United States in 2021. The total was 37%. And if we look at that, that is phenomenal, because what that is saying is that the access to telemed has completely increased, and people have been able to see providers and not have to expose themselves to different things. We're keeping our healthcare system safe, we're keeping our patients safe, and people are able to safely have conversations with their doctors and go through their behavioral health appointments and physician's appointments virtually without having to have any specific contact. Some of the key findings from the data from the National Health and Interview Survey talks about, this was done in 2021, 37% of adults use telemedicine in the past 12 months. And of that, 31.1% were non Hispanic Blacks, and 33% were non Hispanic Asians. So, a lot of this has really opened up a lot of gaps for marginalized individuals and within the BIPOC community to provide more access to providers. So, bridging gaps with barriers. Oftentimes, we hear about how people struggle to get in to see doctors. And now, pre COVID, people were going into doctors' offices. Now, just at the click of your button on your phone, you're able to access a doctor or provider and go through different systems to check and see what are potential problems, and creating spaces to offer additional resources and supports for individuals through telehealth. What this also caused was this living in this new norm, where the transitioning to some of the virtual ways of engaging really caused and created issues as far as communication and how people were able to communicate, causing communication gaps within the communities. And this has gotten way worse than it's ever been, because people have been so used to communicating virtually that they kind of lost touch with the in person communicating. And so it's just causing a gap where providers are losing staff because people want to telework, but it's making it more accessible for the consumer to be able to be at their home and be able to talk to a provider. So now people are having more access to more supports and services, even like referrals, when it comes to anybody that's experiencing any type of trauma, whether it be like sexual assault or intimate partner violence. They're now able to get a lot of service providers in one space and get those referrals done faster, quicker, less travel because a lot of things are being done virtually versus not virtually. So, let's see. I just want to say thank you all for taking the time to listen to my presentation. Feel free to reach out, email me, and check out the website if you have any consulting questions.